The Prime Minister will meet with premiers on Tuesday to present a deal aimed at fixing a healthcare system in crisis. For years, provinces have been calling on the federal government to increase funding. We're told not to expect a final deal on Tuesday afternoon, but to get a sense of what it might look like, what the priorities are, I spoke with the Health Minister, Jean-Yves Duclos, on Friday. Minister Duclos, nice to see you. I appreciate you being here.
Hi, Rosemary, and hello to everyone listening.
Tell me, going into this meeting with the provinces, what are your priorities for healthcare? What are the things that you want to see the provinces saying, yes, let's do that, let's get on board with that idea?
Well, our top priority is to keep looking after all of those that have been struggling over the last years, obviously because of COVID-19. The workers who are tired and sick and have left in large numbers, but obviously the patients. We've seen a large number of surgeries and diagnostics being delayed or cancelled. That has created a lot of stress for families and people. So we want to keep being there for people.
I know that you're not going to give me the offer here. I know that the provinces don't know at this stage what offer you're going to put on the table. The Prime Minister will do that on Tuesday. But can you give me a sense of whether you think it's closer to what the provinces are looking for, and I guess whether you think it will be acceptable to them?
And I understand, Rosemary, and probably many others, that we would like to be speaking about dollars and numbers now. But for two reasons, we want to wait until Tuesday, therefore quite soon for that to happen. First, because we're going to focus on results. We've been, at least at my level, at the Health Minister's level, I've been working with my colleagues for a whole year now, 13 meetings, speaking about the results that Canadians want. Access to family health services, reducing backlogs, investing in workers, investing in mental health, and having a modern data system that enables workers to share the type of information that can save lives. But that will need to come with resources and more dollars, as the Prime Minister said, but we'll need to see what happens on Tuesday.
You talked about all those meetings that you've had with your counterparts. Certainly work was getting done. When I talked to Premier Higgs from New Brunswick a couple weeks ago, he said to me that he thought the thing that had changed, that allowed everyone to get to the point where you're willing to sit down at the table, is public opinion, that people were becoming impatient and really ready to see some kind of results. I wonder whether you agree with that, or whether you think there was something else that sort of unlocked the ability for everybody to sit down and start talking dollars and cents.
Well, I agree with Premier Higgs, and that's in fact what we've done with my colleagues, health ministers in provinces and territories, again, during the last year, focusing on family medicine, in particular in remote and rural areas, focusing on all of those workers that have been struggling, and many of them, or nurses in particular, are wondering whether they can stay in their profession and keep providing the compassion that people expect from them, and all of those others that are struggling with mental health issues. And we know how serious that has become. So yes, I agree with Premier Higgs, and we've agreed together with health ministers over the last year that this was the type of conversation that we needed to have to help workers and patients across the country.
I know obviously that you'll increase the Canada Health transfer. I also know that you've got these side deals that both you and Dominic LeBlanc have talked about a little bit. Why is it so important to have those tailored agreements that are yet to be negotiated, but those unique agreements for each province? Why do you think that is the way to do this?
For two reasons. First, to focus on those shared results that we want to achieve. And Rosemary, the same issues apply everywhere in our country. We see the same challenges, and similar solutions have been identified by many experts, leaders and health ministers over the last years. The second thing, however, is that we need to recognize that there is a level of variability in Canada when it comes to access to family doctors, when it comes to reducing backlogs. So we need to be flexible and working in a manner which is acknowledging the fact that my colleagues, health ministers, don't need to invest their resources exactly in the same way. Some might be investing more in terms of recruiting international nurses. Others might want to recognize those already in Canada. Others might want to invest in more training and more retention of existing workers.
Yeah, you might remember the last healthcare deal before you were a politician. It was sort of sold as the idea of healthcare for a generation. Obviously, that didn't happen because here we are negotiating and with lots of problems still in the healthcare system. What would be your hope in terms of success for this deal and in terms of what might change in our healthcare sector and system?
Well, I think we first must acknowledge that A, we must repair the damage caused by COVID-19, but
right.
B, we must prepare for the challenges that we know are with us and will be with us in the next years and decades. Now, our population is aging. Our population of workers is also aging. More family doctors, more nurses will be leaving in the next years. More chronic diseases, more infectious diseases.
Yep.
Now, there will be future pandemics. Our public health system is fragile. No, drugs, the price of drugs for people listening to us, that has also increased over the last years. So there will be challenges for many years to come. And
yep.
Tuesday
yeah.
is going to be an important step to working towards these longer challenges.
When I talked to the Prime Minister back in December, he said to me, there's no point putting more money into a broken system. Do you think that there is, first of all, I don't know if you agree with him, but do you think there is an acknowledgement around this table on Tuesday that the system isn't working?
Well, that the system worked before, and the reason we didn't perhaps invest enough is that at that time, a few years and decades ago perhaps, no, we didn't have so many challenges. But in
right.
2023, it doesn't work anymore. We have to change the way we deliver healthcare in Canada. Increasing, again, the key thing is increasing access to family health services. We don't want for people to wait until they're very sick and end up in an emergency department before they can receive the healthcare that they need. For example, and many other things need to change in 2023. Maybe we could have afforded that years ago when we didn't have so many pressures, but in 2023 we can't afford that anymore.
I want to ask you lastly about tax points. I know this is sort of it's a kind of a nerdy topic, but a topic of that I think is important to this conversation. Provinces don't generally talk about the tax points that were transferred to them to make up a lot of the difference for the change in the healthcare system. Is that a problem for you, that they don't acknowledge that they have access to that money on top of the transfer?
Well, two things. First, I think it's a bit unfortunate that, and unfortunately that's ended now, unfortunate that we and others certainly spent too much time, in my view, focusing on percentage points and tax points, because the money comes from the same pockets, from the same taxpayers, and serves the same people for the same purposes. So that's I think is now more clear than it used to be just a few weeks or a few months ago. What is now even more clear, as Premier Higgs and others acknowledge, is that we are going to work collaboratively together, as we've done during COVID-19 with enormous success, to serve the welfare, the well-being, and the safety and the health of Canadians, with workers and patients combined.
Okay, Minister, we'll leave it there. Good of you to make the time. We'll be watching you next week. Thank you so much.
Thank you very much.